And good evening. Welcome to the 1004th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you. Before starting the program, just as mentioned by Mr. Sandeep, today we have celebrated the 1000-day program officially at Trivandrum. It's a wonderful session. Around 250 participants from different parts of India participated, including the highest officials of the National Homeopathy Commission, chairperson, then the secretary, and the honorable state ministers and MB from Tamil Nadu and MLA legislators will be member was also there. A lot of persons from different parts. It was a wonderful venue. Most elegant on according to the levels of changing the levels of homeopathy. It also represented a colorful presentation, was indeed a wonderful one. And of course, there was a live program on Facebook also. That is a briefing about the IFPH program, Trivandrum. Very nice. Around 10 to 12 sessions were there. Two special sessions from students of the Sarvation Homeopathy Medical College. And they were very instrumental in supporting us. A lot of participants were participating. Today, our guest is PRAKASH RAO, sir. Is of course.
Yes, sir. Sir,
there is no further.
You have to excuse me because I am out of Pondicherry, so I am continuing this subject because all the persons are there in this. So I will finish this subject. Hindi and English speaking persons all are present here. So we will start the session and continue the session like this. And whatever you told, the drug proving and mechanism of proving of the drugs in allopathic hospital, I decided today that I have to take one by one. So today I am repeating again this research methodology for physicians, general physicians. Then I will go for drug proving.
This is the second part we have, sir. We have already presented part 1 English session. This is the part 2 session, sir. You remembering that?
Yes, sir. Yes.
Yes.
So then I will go for the mechanism of action of the drugs. I want to take up one by one subject.
Yes.
So what happens, sir? Just let us go for this. So let me kindly permission me, Manoj sir, to continue this topic today itself. So let us finish this research methodology topic.
Yes, yes, sir. According to your convenience, you can go, sir.
Okay, sir. Okay, sir. So choose the subject. What is based on an idea, based on the experience, based on the study and self-reading, originality. How to select, say, research process, what research process contains is choosing the topic, find the basic information, refine or modify the topic, locate and retrieve the materials, evaluate relevancies of materials, take notes, construct the project, write literary research work. Just now, Dr. Puru told that we have to build up small protocols which are suitable for clinical practice. I will do it. We know that what are the cases that usually come to a homeopathic doctor in his clinic. So how to do research along with that, how to design a protocol according to our convenience. That is known as writing the literary research, choosing the topic, refine, modify topic. So this will solve our clinical research problems. Homeopathic doctor is basically a researcher. He will do research in each case. No drug will tell that I am the similar drug, you kindly give. He applies his knowledge, his intuition, his thinking power and capacity. He applies the drug. Then he will get success. After getting the success, he comes to a conclusion that he gave the simillimum medicine. Before that, there are no tools. How a simillimum is 100% simillimum. There are no scientific tools except hypothetical tools. There are no biological tools which will decide the simillimum except the hypothetical tools of selecting the case symptom, basing upon the case record. Case record has to be converted into rubric. That rubric again has to be converted into materia medica and organon. Then the science behind it should be understood. Then the pathology has to be understood. Then medicine has to be applied with correct potency. After giving the potency, we have to get the success. If we get successful, then only we will think that this Palestilla has worked up to certain extent and this Palestilla has not worked. So we have to again do the work because we don't have a biological arithmetic, what you call a theology for describing the similar drug. We have a symptomatology. The mathematico-mechanical process has to give answer to the biological problem. The biological problem will be converted into mathematico-mechanical process. First grade drug, second grade drug, third grade drug, first grade symptom, second grade symptom, third grade symptom. It has been converted into mathematics. This mathematics has to be applied. When the mathematics is applied, then that will change the biology. These are known as algorithms in modern medicine. The diagnosis, the MRI scan will be given an algorithm. The corona patient in a hospital will be given an algorithm. Basing on the algorithm, the doctor will prescribe the treatment. These algorithms were basically invented by Dr. Hahnemann, then Dr. Bonninghausen. And now these algorithms are being practiced. This repertory that Bonninghausen has implemented has been criticized by various allopathic doctors. What is this first grade symptom, second grade symptom, third grade symptom? And now the same algorithms are coming for suspected case of malignancy in MRI scan, clear-cut case of malignancy in MRI scan, serious case of malignancy, brain tumor in MRI scan. It also predicts the diagnosis. This is nothing but conversion of biological process into mathematico-mechanical process, which was done 200 years back in homeopathy. Repertorization is nothing but algorithms. But what happened? The knowledge of repertory has been diluted. The repertory started, the new generation people started suspecting repertory because the repertory verification never took place. So it is your responsibility to carry out your own research in your clinics because you belongs to the transitory phase. The new repertory symptoms without proving the drug, without doing enough research, without seeing the minimum needed biostatically viable patients, adopting and approving the patients and incorporating those symptoms into materia medica as well as repertory has made homeopathy more confusing, particularly among the homeopathic doctors. So it is your responsibility to construct your own project, find out the real symptoms of materia medica and carry out the research. Basing upon an idea, basing upon experience, basing upon the study of self-reading and originality. This is what I was speaking, the originality. The originality of the homeopathic physician, originality of the 6th edition of the organon, originality of the materia medica pura has to be scientificized in clinical research, which is possible by the devoted physicians like you, because no institution is giving you support scientifically. No institution is responding to Lancet criticism. But who are the ultimately sufferers? The genuine, honest, homeopathic practicing homeopathic doctors. Because they are not meant to do research. They are meant to do private practice. They are meant to cure the patients. So they are being asked to substantiate their research outcome, which has to be done by the researchers, where the institutions have successfully failed and cheated our own homeopathists, and homeopathic literature from last 100 years never carried out any research. What was the enthusiasm that was present in Hahnemann? He changed his organon for 5 times to make it as more viable and more sustainable according to the science. He has noxious agents. He used one word, again is the cholera epidemic. And he told the cholera epidemic is not because of drinking water. There is some noxious agent, and this noxious agent happened to be Vibrio cholera organism after 10 years. And Mahendra Lal Sarkar, who has treated the entire state of old Bengal with his preventive medicines and his own homeopathic treatment, when the cholera pandemic has aborted in West Bengal, it was noted. See, no homeopathic scientific research topic or the literature has noted, but the Indian Historical Society, a government of India's organization, has noticed his work, and I found that historically contributed. History has recognized the contribution of a homeopathic doctor in controlling the cholera pandemic. This is the research outcome, that is the algorithms, that is the workout, that is the help of the homeopathy. After that only, there are two pandemics that have been controlled by homeopathy. One is diphtheria in Scandinavia and the Vibrio cholera in West Bengal. Nobody knows diphtheria is because of diphtheria organism and Vibrio cholera organism. They both are controlled by homeopathy. And in that, the Vibrio cholera control in West Bengal has been noticed in the history of India, not by homeopathy of India. So this is the research outcome. The greatness goes to Mahendra Lal Sarkar. If anything, if I get your email address, I will send you to Dr. Sridharan Kuru. Manoj sir, you kindly send me your email address. I will send those documents. Then come to this is the importance of research. Choose the study design. Case report, case series, case controlled studies, cross-sectional studies, cohort studies, retrospective comparison, prospective comparison. I told that case reports are possible in your clinical practice. You are taking wonderful case record. Your clinics are supplemented by air conditioning, cushion seats, highly developed clinics, 1,000 rupees consulting. Just I am giving example. 1,000 rupees consultation fees with one excellent computer that gives total rubrics, total materia medicas, references. Now you kindly manage the data of one case, do the first investigation, do the investigation after 3 months, then after completing the treatment, whatever the studies that have to be done, noted down. Kindly note down why you haven't not done the study and what is the limitation of the study, so that you can present your case record. Choose the subject according to your convenience. If you take migraine, you have to take MRI scan. But if you take benign prostate of the ultrasound, 3 times is sufficient. If you take piles problem, you have to note down the symptoms. You cannot show the internal piles in a slide or in photo. So choose the topic. You kindly choose one peptic ulcer where GI endoscopy will be useful before treatment, during treatment, after treatment. Present the case record. The epileptic attacks, control the electric production formation in the brain blood vessels where it will be produced by WBC. Your homeopathic medicines are having antibody antigen production reactions. You will control epilepsy better than allopathic doctors. All you have to understand little pathology. Take the Karn picture before, during, and after. Kindly give medicine. Take one case record. I will tell you later what are the disease conditions we have to treat. Then a case report, description of one interesting and unusual case. This may be unreliable, but form a basis of further study. This may be the only way to report something very rare. See, for example, psoriasis. Leukoderma case. Leukoderma is incurable according to the literature that is available in medical science. But 1% of the leukoderma cases will respond to homeopathic treatment. But which 1% of those cases, which patient comes to us, we don't know. Out of 1,000 patients, one patient of leukoderma will respond to homeopathic treatment, not with placebo. So you have to see 1,000 patients. If all homeopathic doctors in your vicinity are seeing 1,000 patients, you may get that lucky patient. So take out that early control of vitiligo, whether it is possible or not. Take pictures, take the case of psoriasis. If you take a case of anxiety, you cannot take the biological proof. What is anxiety? The patient symptoms only have to prove. But if you take pictures, if you take video, you can do that. So you can show before and after treatment. This is what the unreliability. Description of several cases in which no attempt is made. There is a cancer case. I told cancer esophagus, cancer vocal cords. They are the simplest forms of cancers. So they will do minimum damage. There won't be any special treatment given except radium cobalt treatment, chemotherapy, surgery. Both have undergone everything. Now patient will come for to be fit, to live more long time. Manage the case of vocal cord cancers. Manage the case of esophageal cancers. Manage the case of cancer stomach. Don't go for serious cancers like cancer lungs or cancer colon, where many interventions are needed. See, pancreatic infection you can control with your homeopathic medicines. So these are the cases. They look very rare. Answer specific hypothesis. Everybody will wonder. Then a survey of the frequency of the diseases, its factors. You will note down characteristics. You will understand various things about cancers. Then cervical cancer, why it comes, where you have to send, how to treat, how to become a family physician to the patients. So they all will benefit with a single study of single case. Then an observational study of a group of people with specific characteristic disease. See, I will take a case of migraine. Prepare a case for homeopathic young doctors and homeopathic doctors. There will be a rubric in your head or and headache. Migraine, headache, left side, affect right side of the temples. Aggravation by little voice, little noise, little jar. Spigelia, natremur, sanguinaria, bryonia. Movement of lids will cause headache. Kindly find out the disease which will cause headache like that. Then see whether bryonia is right or wrong. Take the case of 9 migraine cases. Give bryonia. Test the sites. Whether the materia medica is right or wrong, you will find out. Right side, left side, left side. Then how materia medica has been written, why they have written, you will understand the limitations of the science. It is compared with control group. If necessary, you also take one placebo group. Suppose migraine cases are coming. I told just now that migraine cases are tumor cases, are some of the cases where stress, anxiety, you cannot show the biological values, where there are no biological parameters are present. But in a case of anxiety, you take a placebo group. A person without anxiety or with anxiety, treat that case with placebo, and the other case with anxiety, treat with your anti-anxiety medicines that are incorporated in materia medica. Treat a case of migraine with placebo, treat a case of migraine with natremur. Find out the efficacy of the natremur and take 9 cases in placebo group, 9 cases in migraine group. Single blind placebo group. Because patient will tolerate migraine, he tolerated migraine for years together, he will tolerate migraine for another 2 years. So you kindly test migraine with placebo, migraine with sanguinaria, migraine with natremur, migraine with natremur 6. Because if you have 90 cases, split the cases. Give migraine 6 potency natremur to 10 patients, 30 potency to 10 patients, 200 potency to 10 patients, where it affected, whether symptoms came down, and 10 cases to placebo. So you will understand the real picture of the migraine. real picture of the potency, real picture of the natrimune. Because migraine cases will come to clinic a lot, to any homeopathic doctor's clinic. Then observational study, where characteristics of the people of the disease cases, he will report something. I told previously, he will have chronic otitis media. Then he will say that his legs are paining. Pain and chronic otitis media, nothing to do. If there is something, what is the relationship? Whether the chronic otitis media patients will come with that, why the pain, why the piles problem, fissures in ano problems are increasing during summer season? What is the relationship of the summer with skin disorders, with fissures in ano? What is the relationship of dehydration of drinking water with the bowel movement? Where the bowel movements are constipated, how it will cause fissures in ano? So why the patients of spercalcanium will increase during the summer period? What is the infection rate? How the bacterial growth will come? These all you will understand. Then an experimental study where intervention is applied in one group, the outcome is compared with the similar group. This is known as double-blind, randomized, study controlled. This is possible only in an inpatient hospital or in a laboratory. So as a physician doing that, you need 2-3 physicians combined together in a big hospital, as Manoj sir previously told, in any big institute where the teaching institute can carry out these double-blind randomized controlled studies. They are not possible in clinics. Best study is randomized controlled double-blind studies. The double-blind studies will come at a later stage, but first we have to get confidence that is possible only in clinics. Why the homeopathy is sustaining, being criticized all these days? Do you think that the research present in homeopathy making homeopathy to survive? No, it is because of you persons like you practicing clinical practice from village to the metropolitan city, clubbed with your clinical knowledge, that is making homeopathy to survive, not the contribution of the researchers present in research in homeopathy. Our contribution, the research contribution, despite knowing the problem by the research is, or the researchers is only 10%, only 5%, below 10%. But the contribution of the physicians, where the institutions came, where the colleges came, where the hospitals came, just they are because of the clinical practice of the homeopathic doctors, which made homeopathy to survive. Being criticized, one criticizing article, everybody will criticize, but the system is sustaining just because of the physician like you who are practicing at the countryside and providing protection to the homeopathic system of medicine. This is not possible in all cases. Maybe unethical. Best study is randomized. The randomized control studies are not possible with single person. It needs institutional support. All the institutions came because of physicians. All the institutions not came because of the research that is present in homeopathy. So study sample, large enough sample, treat as many cases as migraine, seize fissures in ano, treat allergic bronchitis, treat tonsillitis. Then you will find out the acute data, accurate measurements, quality control, compliance of the cases controls. Try to keep up these simple. Define your objectives. Don't complicate, because your homeopathy itself is complicated. One medicine is antidote to the same medicine. Bryonia is antidote to Rustax. Bryonia is complementary to Rustax. Bryonia is follow-up to Rustax. How, where, why? Neither your Materia Medica describes, nor your teacher in the college describes, nor the Materia Medica Pura describes, nor anybody thinks to describe. Nobody thinks of that. A young fellow who is studying 3rd year of homeopathic undergraduate will ask, sir, how it will be a medicine with complementary as well as antidote, sir? Nobody can explain. There the research is needed. So don't select a topic that make a chapter, make your topics very simple. However, use the opportunity. Get the help of all these stages. Experienced researchers are there, senior colleagues, your good friends will make the problems to solve. Literature, sir, who has written, who has faced problems like us in their clinical practice. See, Kent got so many cases, but in Switzerland, the doctor who is very popular never gets the case, because the Switzerland health statistics are so nice that you have to take appointment and come. The government has to be reported that so and so person is ill and sick. If he comes to homeopathic doctor, he is already under allopathic treatment. And if from Switzerland one homeopathic doctor reports something, don't be magnetized. He is telling lies, because there he won't get patients. Patients are in India, Pakistan, Bangladesh, Sri Lanka, Malaysia, Singapore, China. Patients are not in London, patients are not in Germany, patients are not in Scandinavia, patients are not in Switzerland. So the homeopathic doctor who writes a textbook for you, he is telling totally lies. He is writing without seeing any patient. He has not done, and they are not allowed to do the biological investigation. No foreign homeopathic doctor knows what are the normal thyroid levels, what is antigen antibody reaction, what is immunoassays. You kindly show me any textbook that is presented from 1960 to 2023, a book that is published by a homeopathic doctor of using biochemical values or biological values. They write that symptom, this symptom, below, above, 20% aggravation, 10% aggravation, morning aggravation, evening aggravation, homeopathy, that, this. They twist, but they never compare with biology. Hahnemann compared his system with biology. Read all the references. Most of these will be vital when writing up. And our people will go and take diplomas, degrees from foreign countries in homeopathy, and they come up. Where you are, India is offering PhD. There the homeopathy is not recognized. One by one country is fading away homeopathy. The reason is a mechanic is a homeopathic doctor. What is the condition that was persisting in homeopathy in India 50 years back, where it was fully crowded with RMP doctors, but all of the RMP doctors were devoted doctors. And because of them, today we got the institutes. But in foreign countries, there is no devotion. They practice because they have to practice, because it is more commercial. The protocol, design a protocol, a simple protocol. If you ask me, we will design. Dr. Sridharan Kurup has told already that we will make simple protocols. Then why I am insisting on physicians' research is, now the institution never take up any research. They have the previously, if you take any homeopath who is practicing classical homeopath, they will call the integrated system of medicine, what I am talking now, as a mixopathy. So in the same fashion, now it is you the physicians who have to carry out the research, maintain your own system against the Lancet. It is not the institutions, they are going to support you in research. So this is where you have to start writing up your paper, write introduction, methods in detail, ethical considerations, analytical methods in detail. Think of your budget also. If patient won't carry out one ultrasound, you should be in a position to carry the third ultrasound, so to see whether the tumor came down in size or not. What are the changes, where the renal calculi, whether went out or not. You have done urine culture. You have done the ultrasonography. So you have to see the metabolic changes, why the calcium stone is being formed, what are the changes. If the test is being done with the patient, if patient is not viable to pay the money, you should be in a position to think you have to spare a budget of at least 10,000 rupees to carry out your research. You have to take out some of the part of your country. You have to contribute something to your research. If you are earning daily 10,000 rupees, at least you have to pay 100 rupees for research. So you can have your clinics highly oriented. You can put a board that so-and-so clinic and research center. See what is now infertility clinics are doing. Wonderful research. They do artificial insemination. They will make a woman pregnant. They will carry out. They take for 9 months. They will conduct the delivery and they will send it out. Now I am not talking the other social aspect of these things. But as far as scientifically concerned, the infertility centers are highly efficient clinical research centers. So you plan in that way. Think of ethical consideration. Analytical methods indicate, think of your budget and study assignment of roles, project time completion, take up a research, give time-bound program. Benign prostate hypertrophy needs 1 year. Renal calculi needs 3 months. Follow-up needs 1 year. We have treated the renal calculi case acute in 3 days, chronic in 3 months. Then after how many days that patient is getting recurrence of the renal calculi, whether he is developing recurrence or he is under control, under the management from last 10 years. Once you publish a paper with biologically viable subjects, that is 9, compared with placebo 9, or not compared with placebo, out of that 1 patient remained under you from last 20 years. He was a renal calculi patient. Today also he never developed renal calculi. Take first reports, take today 1 report. Now today he might have developed some other disease that is irrelevant. Once you treated renal calculi 20 years back, you can authentically tell that from last 20 years, patient is not suffering from or not suffered from, not developed any renal calculi, and homeopathic cures. Further studies are needed. Then if somebody gives funding, you kindly take funding. If some voluntary organization or somebody or homeopathic associations or people who are working around you like this, take the responsibility, data collection, accurate setting, stick to protocol, stick to sample size. These 5, 6 are very important. You are opening your clinic in time, you are opening your clinic, closing down. At the same time, the responsibility and the interest you are taking on the earning of the money in the clinic, kindly show the little interest on responsibility, data collection, accurate testing, sticking to the protocol, sample size. In simple case, why I am talking about this subject, this topic is, no homeopathy research will save you telling that your system is scientific. Now all these days you are homeopathic physicians. Now you have to convert yourself as homeopathic physicians as well as researchers to save yourselves. Then 2 reasons your papers will be rejected. Content format. Paper, whatever may be the result of the paper. A paper, if it is written in particular model, it will be accepted. Because the result, you are the responsible. You have given drug in a chosen way, in a protocol. Drug is not successful. You are not responsible. But why paper is rejected? So there is content in the paper, format in the paper. Get a copy of the journal you wish to publish. Similar article in detail, you go through the authors, you can publish the papers. That is how to writing paper also I give. Write up your papers is reviewed by experts. Get help before sending it. Locally, you have many allopathic doctors, friends, researchers who are carrying out research in. Don't go to allopathic doctor, biostatisticians, biological experts, zoology specialist, botany specialist, biology, entomology, epidemiology. So take your paper. There you have reading a protocol of paper. You kindly show them, then he will help you. Then authorship. How to give authorship? You can give. Should be the main author. These all are after that. Now, what are the areas of the research you have in homeopathic medicine? understanding, see, as a scientist, I have one great responsibility. The first is understanding the mechanism of action of homeopathic medicines, biological, physical models, keeping proper controls. This was not done. Now here I haven't written, your drugs were not standardized. The 30 potency in Kottayam from one pharmaceutical company is different from 30 potency in Ghaziabad of another pharmaceutical company. The 30 potency of the same drug in Calcutta is having different content of the chemical than the 30 potency in Hyderabad. So these were not standards. Mother tincture is not standardized. 3x is not standardized. 6x is not standardized. 12x is not standardized. Why I am talking about these X, B12X? So when these were tested, no drugs are standard. One fellow will mix 1:9% of alcohol. One fellow will mix 1:40-60% of alcohol. One will tell 95% alcohol is best. One will use ethanol, not alcohol. One will use 60% of the water and 40% of the alcohol. They are jeopardizing themselves. The minimum what a undergraduate or a 10th class biology fellow knows, our pharmaceutical companies knowingly not doing this work. When your drug itself is not standardized and sent to, see, if you say take paracetamol, if you test 500 milligrams of paracetamol, if somebody producing some pharmaceutical company, the paracetamol in that brand and name of 500 milligrams is not present, a case will be filed. But in homeopathy, nobody knows what is what. And nobody knows how the pharmacies are preparing. The pharmacy preparing persons are highly knowledgeable than the scientists present in the organizations. They are very honest. So that's why kindly standardize your drug. Kindly write to the government, make some fundamental principles to standardize your drugs. Right. This I never touched here in slides because I myself feel insulted being a homeopathic doctor that nobody has taken up this one. To understand the accession of success and trituration, vehicles, what is vehicle? See, what is the carrying out the drug? How alcohol will become vehicle? What happened to alcohol memory? What is the scientific viability? How milk glycerin will become vehicle? Why petrol is becoming vehicle? If petrol is becoming vehicle, how the saccharin or sugar of milk is a medicine in homeopathy? How the petroleum product is a homeopathy? These all are doubts we will get. These all are the scientists work out. So number 3. Number 4, I orally told. Explore and now come to homeopathic principles. What is this miasm and theory of miasm applicable to at what level, every level? And what are the symptoms that developed, how you gave medicine, how you are successful? What is this Herring's law of cure? Everybody teaches. If you properly won't answer, that particular student will be failed. If you won't write correctly the Herring's law of cure. But you kindly tell me, anybody in this world got Herring's law of cure of treatment for his patients? So I will talk with any homeopathic doctor who is practicing it, the topmost homeopathic doctor who has written books. Ask him, have he seen in his lifetime Herring law of cure of treatment? All the 12 observations of the 10 that they are failure, 10th observation, nobody has seen Herring's law. But that is a textbook for you. If you won't answer Herring's law, that particular student will be failed. Ask honestly any doctor, has he seen in his clinic, he has seen treated the case on Herring's law of treatment. The first disappeared symptom will disappear last, and the last disappeared symptom will disappear first. Has he seen his lifetime? Has he seen, anybody has seen the skin disease will disappear last and the pathological changes in the heart takes place first? Hepatosplenomegaly or anything? All they never did any scientific study. I am not talking against the Herrings. I am talking not doing research of the Herring's law. The homeopathy as a personalized medicine. All the personalized Princeton medicine, all the medicine individual considerations are developed on homeopathic principles. They are copying our organon of medicine. They are writing the highest ideal of cure is rapid, gentle, and permanent prognostication. But our homeopathic doctors are not in a position. Our institutions are not in a position. Our homeopathy, at least organon, has to teach ethics to allopathic doctors. Our great homeopathic doctors could not convince the allopathic doctors, ethical committees, that we will teach you ethics. They never did up. Right? 10, 12 observations. Nobody studied so far. 1 or 2 cases. You don't find on any topic in homeopathy more than 10 papers. Bronchial asthma 10, epilepsy 3, peptic ulcer 4, migraine 5. You will find only more than 10 research published cases or what you call articles on menstrual disorders and on stress disorders. This is the status of scientific development of homeopathy. So that's why I am stretching. Then usage of potencies, various skill. See, Hahnemann himself changed it to 6th edition. He asked us to forget 5th edition. But we are not forgetting 200 potency. We don't have confidence on LM potency. We will argue that when we are getting result with 200 potency, 1M potency, why I have to go to LM potency? Whereas you compare with your allopathic contemporary, he never gives penicillin. Penicillin is outdated antibiotic. He follows. See the moral standard of the education, the scientific development of the education. Why we have to know? Even if we want to do, a scientist like me want to do, I will not be spared by my pharmaceutical company. Because my pharmaceutical company fellow is more influential, more rich than my science. So usage of no source. What are these no source? You nomenclatured a disease product as a disease product. Why that so much of importance no source? In between I gave no sword, in between I never gave no sword. See what does no sword contains. Everybody has brought the products. They thought that the no swords will help the disease and control and prevent the disease. All the no swords failed in controlling, preventing the disease. Medorinum failed in controlling gonorrhea. Sorinum failed. Now recently COVID-19 no sword he brought. When the no sword is, they don't know the fundamental pharmaceutical is having SFM. When the no sode is mixed with alcohol, the virus that is present in bacteria, it will become a dead virus. Dead virus become proteins. Protein symptoms. See, recently I studied one proving that is cyclosporin. Cyclosporin is a medicine that will be given to the kidney failure patient, kidney transplanted patients to manage the transplanted kidney in the body. It maintains the antibody antigen reaction. So that fellow came with cyclosporin proving, and he says that cyclosporin I proved. Therefore, cyclosporin homeopathy has to be. Once you swallowed the drug, including the snake poison, it never becomes as poison. It never shows any poisonous effects because it contains protein. If the body of the prover don't contain any ulcers in the mouth or in the stomach, the protein enters into the body, will be excreted through urine and fecal matter. Protein never bites. It is the bite of the injury of the snake that will make the snake poison into the blood. These fundamentals were not understood, and all the no source failed to deliver the goods which what expectation they proved. Right. Then I am telling what expectation they proved. They are useful for some other disease. Right. Then imponderables, how a north pole of magnetism will be melted in alcohol, which physics rule says, why they are cheating the students who finished their plus 2 with highest standard scientific knowledge. Magnetic cannot be melted in alcohol. Who will save us? That's why you have to take up research. Drug proving on animals, this is a debate that subject. They were not having confidence at all. Placebo being criticized by Lancet, but our ancestors already decided homeopathy is placebo from last 60 years. Very timid fellows. These are all belongs to scientific. Come to the fundamentals. Clinical and research various subjects. Otitis media, tonsillitis, peptic ulcer, bronchial asthma, hemorrhoids, fissures, migraine, conjunctivitis, sinusitis, anxiety, stress, distress disorders. You all will get such cases in your homeopathic hospitals. You are highly most efficient, successful physician in treating these cases. Then renal calculi, yes sir. Another 2 minutes. Dietetical disorder, orthopedic disorder, skin disorders, nephrological disorder, locomotor, gynecological. These all failed cases in allopathic hospitals will come to you. You should be a neurologist. You should be a endocrinologist. You should be an orthopedic physician. You should be a infection specialist. You should be a dermatologist. You should have more knowledge than your gynecologist. And you should have more knowledge than your nephrologist. After all, you are a homeopathic doctor. Understand? You should be a super specialist. That's why Hahnemann called prognosticator, diagnosis, unprejudiced observer. This nobody stresses. When you are curing a case of gliomyoma or basic ganglionic tumor, nobody understands. Apart from this, everybody says all the fools will criticize homeopathy, but all the scientists who are criticizing homeopathy will accept that agro-homeopathy is scientific, veterinary homeopathy is scientific, homeopathy in marketing is scientific, homeopathy in industrial research is scientific, and homeopathy on economic issues is suffering. When homeopathy is bogus, how it is agro-homeopathy is successful? The same scientist will do investigations. That same Lancet will say that veterinary it is useful.
Excuse me, sir. How
So
many
these are
time minutes, sir?
Yes, sir. Biostatics, types of data. This you have to understand. This is the last slide, sir.
Yes.
Origin and development of biostatistics, definition of biostatistics, reasons to know about biostatistics, graphical representation of your data, frequency of distribution of your data. Thank you very much. All small things. You are already doing big works. Kindly take up research at your clinical levels, at clinic levels. Then you can be prevented from criticism from allopathic as well as from scientists and Lancet and unnecessary pseudoscientists. You have to be careful from pseudoscientists in homeopathy and pseudoscientists from outside. Thank you very much.
Okay.
President and Executive Committee, Sridharan Kurup sir, Dr. Dhanesh sir, Dr. Manoj, Dr. Sandeep Peters, and who patiently heard my difficulty, my anxiety, my emotion of homeopathy, where it is going, why you need clinical research in your clinical practice, why a homeopathic physician should be a researcher, and what is the importance of the research for general physicians.
Okay.
Thank you very much.
Yes.
Now it is open for discussion.
Time for
Thank you, sir.
discussion. Those who would like to participate can go to the participant list and raise your hand. And of course, when it's about science, pseudoscience, we must remember that the science is not complete. A lot of things that were considered yesterday, not scientific or unscientific, now recognized as scientific. For just example, the use of this coconut oil. A lot of so much praised scientific studies were now no longer useful. Why? As rightly said by Hahnemann, majority of these cases we can see they were often cunningly devised for convenience, for promoting certain products. Then the cholesterol theory, a lot of conditions are there. Then another, you must think, you reflect that why these medicines, the so-called scientifically proved medicines, later found to be very, very dangerous. For example, the ototoxic drugs, once widely used for tuberculosis, now they are not used. So such problems are there. So when anybody is arguing strongly for this scientific community, the so-called science, and calling others by our ignorance as pseudoscience is the greatest mistake by any physician, I think. That's a major thing. Then another thing is the Herring's law of cure. Of course, a person who has got the ability to select a remedy according to the homeopathy principles, I hope definitely will feel it. That is my experience. Because what is the basic thing? You must select a remedy. Then you must give in the minimum dose. When we follow all these things, thousands of homeopathy physicians all over the world are getting that. That is why you are still following that. Then again, you said about this no source. It was found prophylactic. Yes, definitely, because we are selecting a medicine not upon similarity of its name or contents, but by virtue of its similarity in its ability to produce symptoms. That is why we use arsenic album as preventive, not COVID, no sort. That we must understand. Homeopathy is not the similar medicine, same medicine, but it is a similar medicine. So that is the point. Then again, you said about the honesty of the pharmaceutical companies. I don't think, sir. Who can say these fellows claim the COVID vaccine was effective in containing this COVID? Now what they are saying is they never claim that it will control, but it will only it will modify. So these are the greater lies. How can you say they are honest? A lot of problems are there. We all know that the influence, the wrong methodology, the wrong tactics, they're playing for getting money. Sridhar, sir, what is your opinion, sir? Yes, sir. Please unmute, sir.
In experimental, we must have to prove it and to find out whether it is correct or not. Simply, we cannot say some people are from Bombay, some people are produced that the COVID no sort. I don't know. Without proving, we cannot say. Or some experimental study we must have to conduct, but we cannot, without knowing, we cannot say and criticize also. It is not good. What I feel, we must have to find out whether it is having any data is available, whether it is. I think that it is not approved by the government. Without approving to the government and intent pharmacopoeia, you cannot market it and to do it. But anyway, I think that in future that also can be done, and it may be do. Then only we can say it is correct, because all our medicines in ancient time, it is proved and reproved and retested, irrespective of region, religion, and the age and sex. Without that, it is done and it is reproved. Because once I was discussed with the doctor, our late Dr. R.P. Patel, he was telling that olden medicine, that is why Kent repertory and morning cousin repertory is more valid till today, because there it is verified and re-verified. But now there are so many repertories are coming, regional repertories, that, these and etc. We cannot say result is 100%, it is not sure. But earlier it was not like that. During the time of Kent or morning cousin or Hanuman or whoever it may be, it was very effective, and still it is believable. So that there are thousands of medicine are coming nowadays. It is not proved and reproved. It must be, then only we can say it is workable. Simply one or two persons may say something, we cannot accept it. What about the opinion about our Dr. Prakash Rao? Please, you may say, what about your opinion?
Yes, sir. Prakash Rao, sir, please.
Sir, you are right. They have to be tested. We have inquired. The no soda from Bombay is not validated. But they are, see, when the government has not allowed us to go near to the patient of COVID or Corona and collecting and proved, for that itself he has to be punished. And he was given that. So this is number one. And the standard of the medicine, if the Corona has been induced, this particular virus will cause by swallowing itself the disease. So for that, they have to be charged. Without doing animal proving, one cannot carry out human proving. So there the homeopathy is hitting back. That's why nowadays the drug proving is outdated. Only private doctors are taking the drug proving. The government institutions cannot carry out the drug proving because they don't have any facility to carry out animal proving. Without testing any drug on animals, it cannot be directly be tested on human beings. So there the homeopathy has crossed its ethical issues according to the latest proving of the drug or the scientific developments. So, but unofficially it is being sold because when the test was done, it is only placebo. It contains 95% alcohol. So placebo control, nobody is harming anything, nobody is, and everybody is purchasing infusory. It is like mixing homeopathy and allopathy, or in many homeopathic doctors, qualified doctors combine various drugs at a time to the patient and they give. They are also finding success. It is like that. In the same fashion, it is being controlled, and everybody believes that homeopathy knows what has been developed. And a person who don't want to improve their knowledge in homeopathy may tell that a homeopathy knows what has been developed. There are cults, there are schools, there are patronizers. So where there is good, there will be also bad. So things are going on like that, but
Yes,
it
sir.
is not proved, it is unscientific.
Then one thing we must remember that the vaccine, COVID vaccines, it claimed that it was successful after 4 months of study. How can you say after 4 months of study a
Sir,
vaccine?
for this I will give you one answer. See, it is politically number one. It is to create placebo effect number two. All the scientists joined. The government, the politicians, the WHO, the Prime Minister of every country wants to produce vaccination as early as possible.
So, yes, sir. So that means it is the
People who are creating vaccination, they clearly told that 5 years are needed to carry. We cannot give. So the government wants to introduce, and they made minimum studies. When the clinical trials came, it failed. So they told lies, and they told that it will modify.
Yes,
They told
that is the point, sir. That is the point.
it is an accepted lie. It is accepted. Yes, it is accepted truth.
Yes.
See, I will tell you one thing, sir. I will tell you the
Excuse me,
allopathic
sir.
doctor's treatment and their. Sir, 1 minute, you kindly let me tell this point. You kindly know what is the plasma supplements transfusion during the COVID period.
Yes.
So plasma, there was charitable for. They used to collect plasma from Kottayams, used to send to Delhi, from Delhi to Hyderabad, from Hyderabad to Nagpur, Nagpur to. So plasma, ultimately after 1 year, they came to know that plasma don't have any effect over the COVID. So how much blood they extracted, how much money they wasted, how much tempo they created, how much burden they created in the society, and how much loss they created. They are the modern sinners, devils, and ultimately the plasma treatment found to be not at all useful for corona. And whoever gave whatever may be the most popular doctor of any hospital, any corporate hospital in country, they have eaten their humble pea, and they are the most shameless fellows on the earth, and they have damaged the country economically, socially, morally. They
Okay,
are the
sir. Yes,
full
sir.
half an hour.
Sir, we have to finish in time, sir. Sir, please express a lot of thanks. Yes, sir, please.
Yes, Dr. Prakash Rao, your that classes are very useful and very interesting. Please come with such type of data and such type of research project and come again. Thank you in behalf of to the IFPH.
If anybody is accountable, if I am in power, I could have charged the allopathic doctors for without testing, giving plasma, and the created burden in the society of India for getting plasma. One has to be punished that nobody has taken steps. They have done a medical blunder and medical criminal
And
act.
sir, now
Sir,
this
please
is the
conclude, sir.
time to
Please
hand
conclude.
over to Malayalam section. Sorry, sir.
Yes.
Thank
Yes,
you very
sir.
much.
Thank you.
From my heart.
Thank you, Dr.
Thank you very
Kurup,
much.
Thank you very much for providing me opportunity. Thank you,
Okay.
Manu,
Yes.
sir.
It is
Ask
time
them to write
yes.
any questions to my email address, sir. I have given.
It is a time to wind up the session. May I invite Dr. Shaila to continue the program in Malayalam. Hope you to meet same day tomorrow. Till then, goodbye.
Thank you, sir.
Shaila, please continue.